I thought it was particularly nice that she did offer to do that for me.
And you know, women who do have a family member or a spouse there with them, will encourage them, have that person take notes for you, because a lot of times, the more ears and eyes you have, focusing on what's being said, the more you are to absorb everything.
On the second trip I think I made to see my oncologist, Dr. Oldham, I went in with a list of notes, and from that point on, the little piece of paper they give you with your insurance stuff on it that you hand to the nurses says on there, in parentheses, in quotation marks, patient has notes.
That's funny.
All right. You did mention that it's very rewarding to you to see some of these patients get through this journey positively, and it just has to be on a day-to-day basis working with people and seeing how far they come, and kind of knowing that they started scared to death, and here they are, positive, and they've gotten through this experience. So I do remember that you said that you were involved with a breast cancer support group.
There are a couple different cancer support groups here in Lynchburg. One of them, which we personally facilitate, is called On Eagle's Wings. We meet the first Thursday of each month at the Timberlake Mammography Center over on Timberlake Road at 6 o'clock. The other breast support group that's available in this area is called Breast Friends, and it is a group, actually it was started by two of our younger survivors who were in kind of a different phase of their life as some of the older survivors. Right. And they started that to kind of, better meet the needs of women, career focused and raising children. And they meet the second Tuesday of every month at the Pearson Cancer Center at 7 o'clock.
I think that's wonderful that you do have that. And what do you do at your meetings?
It varies from month to month. It's a little bit different. We have, we try to bring in a variety of guests covering different topics, osteoporosis, physical therapy, exercise, nutrition, a lot of different survivors deal with, a lot of different topics. We also try to do a kind of a pamper yourself night a couple times a year, where we'll have massage therapists or manicurists come in and just pamper the ladies, give them chair massages and mini manicure, and they love that.
I think that people, I've mentioned it on this show on numerous occasions, but I don't think people realize how important it is to feel like yourself as much as you can when you're going through this. And a friend of mine had a terrible chemo, but she said every time that she was not throwing up, she put her makeup on, and that it made her feel so much like herself, and that's such an important aspect of getting through this is looking in the mirror and seeing yourself. Right. And I know that you all will suggest places that your patients can go if they need a wig or that kind of thing. And of course the image recovery shop is right there, which is, I think again another innovative thing that Centra Health has done. Who can attend these meetings for the support groups?
We try to keep it, to survival. If sometimes we've had spouses come and it just, kind of creates some tension for the other women. They aren't maybe as open to share different things. And we let the women know that this is a safe place. What you share here is confidential and won't be, around Lynchburg. So we want them to feel comfortable and safe to share what they want to share.
That's good. I mean, I really hadn't thought about it being a confidential situation, but I'm sure it is. Now there are cancer support groups for younger women as well as older women.
Well, Breast Friends is primarily focused. The primary focus audience is younger women, but there are older women that attend also. I think a lot of it depends on which group you're more comfortable with. And on Eagle's Wings, we have women anywhere from their 40s to their 70s, so pretty much just what you're comfortable with.
I don't know that women know how many opportunities there are to look like themselves if they've had a mastectomy. And reconstruction is out there. We have excellent plastic surgeons here in Lynchburg who will do that. And something you said just made me think of a woman who was 74 who came to the operating room when we were doing implants in the operating room to get reconstructed on one side, and she said, I'm sure you must think that I'm crazy at 74 years old to be here having this done. And you know, this was you, but my thought then, and it is now, anything you can do to make yourself feel good about yourself. And it has to be the people who've had mastectomies. I'm sure that while you're not thinking about it every minute, if you close off for a shower, it's always in your mind. And you know, to be able to have reconstruction, I think is a good thing. Are there support groups for men individually? Do you know of anything like that?
There is a caregiver support group that meets in Amherst, and I think that's also the first Thursday of every month. And that is open to caregivers, friends, family of survivors of any type of cancer.
Okay, you know, the caregiver, I think that people think of you as the patient, but they don't often think about your spouse or the caregiver. You know, it's just as tough on your caregiver or a spouse as it is on, almost as it is on you. Because my husband said to a friend of ours, he said, how do I treat her? And she lost a husband with lung cancer, and she said, you treat her like you always have. And from that point on, he never has treated me any differently, and I just think that that's so important.
One of the books, actually, that reminded me of something. I recently completed my master's, and one of the books that I read as part of that is, it's called The Breast Cancer Husband, Helping Your Wife and Yourself Through Diagnosis, Treatment, and Beyond. I think the author is Mark Silver. Excellent, excellent book. But it's written from a breast cancer husband, and just kind of his perspective on going through the diagnosis and the treatment phase with his wife.
Write that down for me before you leave, because I would really like to read something like that, because like I said, my husband has been so helpful to me. One thing that I love, and I don't know how much you know about it, but I was interested to find out about the onco testing. That this is something that they offered me early after my diagnosis and after my surgery, and I was getting ready to go into onco. You can have a section of your tumor sent to a lab in California where they do gene testing. I think it's 21 genes they test, and DNA testing on your tumor itself. And the results, where you come in on a scale, tells you what the likelihood is of a recurrence, and that really helps you make decisions.
Also helps to make treatment decisions. If your specific type of cancer would best be treated by endocrine or hormone therapy alone, or in combination with chemotherapy. So it's very helpful for a lot of women, and also for the physicians in developing a treatment plan designed specifically for you.
Yeah, I was glad to know that that was out there and have the opportunity to use that. You know, in my decision making, although my numbers were in a really funny spot, and it came back to me making the decision on my own whether I wanted to do the chemo. And being a nurse, I just felt like if I didn't do it and something reared its ugly head down that I would always wonder if I had made the right decision. So, you know, I did it. I'm through it, and I'm delighted to be out here telling other people, go get your mammograms. All right, Kara, we have about a half a minute left. I want to thank you for coming on the show and sharing with everybody what your job is, and to let them know that you're out there and that help is available. You know, you're not just pushed through the system. You're treated very much like an individual and not a number. And I do appreciate that.
Thank you so much. Thank you.
All right. You all have a good evening. I'm glad you could be here with us tonight. We still have some really interesting stuff coming up. The next show will be our Halloween show, and you don't want to miss that. All right. Thank you.
Thank you.
Good night.